As you age, maintaining optimal health becomes an increasingly complex challenge, often leading seniors to seek out supplements in hopes of filling nutritional gaps, boosting immunity, or enhancing overall well-being. While supplements can be beneficial when used appropriately, many are marketed aggressively to seniors, promising health benefits that are not only unproven but can also cause significant harm. It is crucial to approach supplement use with caution, understanding that not all products labeled as natural are safe, and some can interact dangerously with medications or underlying health conditions. One of the most common supplements that seniors are encouraged to take is high-dose vitamin E, once hailed as a powerful antioxidant capable of preventing heart disease and cancer. Recent research reveals that supplementing with vitamin E in large doses can actually increase the risk of bleeding, hemorrhagic stroke, and even all-cause mortality. Vitamin E, especially in doses exceeding 400 IU per day, can interfere with blood clotting mechanisms, making you more susceptible to bleeding episodes. For seniors on anticoagulant medications, such as warfarin, taking additional vitamin E can dangerously amplify the blood-thinning effects, leading to uncontrollable bleeding. Moreover, large doses of vitamin E have been associated with increased risk of prostate cancer in men and other adverse effects, undermining the very health benefits they are supposed to provide. Similarly, high-dose vitamin A supplements pose significant risks to seniors. While vitamin A is vital for vision, immune function, and skin health, excessive intake can lead to toxicity, known as hypervitaminosis A. Symptoms include dizziness, nausea, headaches, blurred vision, and in severe cases, liver damage, bone fractures, or increased intracranial pressure. Seniors are particularly vulnerable because they often take multiple medications and may already have compromised liver function, which impairs the body's ability to process excess vitamin A. Chronic overdose can also cause osteoporosis, increasing fracture risk, which is particularly dangerous for older adults already at risk of falls. Calcium supplements, widely recommended for osteoporosis prevention, are another supplement that can do more harm than good if not used carefully. While adequate calcium intake is essential for bone health, taking excessive calcium supplements has been linked to increased risk of cardiovascular disease, kidney stones, and arterial calcification. Research indicates that supplementing with calcium alone, without considering other factors like vitamin D levels, magnesium intake, and overall diet, can lead to calcium deposits in arteries, potentially increasing the risk of heart attacks and strokes. Moreover, calcium supplements can cause constipation, bloating, and gastrointestinal discomfort, which are common complaints among seniors. For many, it's safer and more effective to obtain calcium through dietary sources such as dairy products, leafy greens, and fortified foods, and to use supplements only under medical supervision when dietary intake is insufficient. Another supplement frequently used by seniors that can be harmful is herbal products, especially those marketed for memory enhancement, energy boosts, or immune support. Many herbal supplements, including ginkgo biloba, St. John's wort, and echinacea, can interact with prescription medications, leading to dangerous side effects. For instance, ginkgo biloba, often taken to improve memory and cognitive function, John's wort, used for mild depression or mood regulation, can interfere with the effectiveness of various medications, including antidepressants, blood pressure drugs, and blood thinners, by inducing liver enzymes that metabolize these drugs faster, rendering them less effective. Echinacea, popular for cold and flu prevention, can cause allergic reactions or immune system overstimulation in some seniors, and its long-term safety remains uncertain. Iron supplements are another area where harm can outweigh benefits, particularly for seniors who do not have diagnosed iron deficiency anemia. Iron overload can cause oxidative stress, damaging tissues and organs, especially the heart, liver, and pancreas. Excess iron is associated with increased risk of cardiovascular disease, diabetes, and certain cancers. Many seniors are prescribed iron supplements without proper testing, leading to unnecessary accumulation of iron in the body. Furthermore, Iron supplements can cause gastrointestinal side effects such as constipation, nausea, and abdominal pain, which can significantly impair quality of life. It is essential to have blood tests confirming iron deficiency before starting supplementation and to monitor iron levels regularly. Additionally, some seniors turn to omega-3 fatty acid supplements like fish oil in hopes of reducing inflammation and improving heart health. While omega-3s have proven benefits when consumed through diet, taking supplements in high doses can sometimes cause bleeding problems, especially in those on anticoagulant therapy. Excessive omega-3 intake can also suppress immune responses, making you more vulnerable to infections. Moreover, fish oil supplements are often contaminated with environmental toxins such as mercury, PCBs, and dioxins, if not properly purified, posing additional health risks. For most seniors, including fatty fish like salmon, mackerel, and sardines in their diet is a safer, more balanced way to obtain omega-3s, complemented by supplements only under medical advice. Another supplement that warrants caution is glucosamine and chondroitin, often marketed for joint health and osteoarthritis relief. Although some studies suggest mild benefits, evidence remains inconsistent, and these supplements can cause adverse effects. For seniors with shellfish allergies, glucosamine derived from shellfish can trigger allergic reactions. Both supplements can also increase blood sugar levels slightly, which is problematic for seniors with diabetes or prediabetes. Moreover, they may interact with blood thinners, increasing bleeding risk. It's essential to consult your healthcare provider to determine whether these supplements are appropriate and safe, considering your overall health profile. Although probiotics are generally considered safe and beneficial for gut health, they are not universally harmless for seniors. In immunocompromised individuals, including some seniors, probiotics can cause infections such as bacteremia or fungemia. Additionally, certain probiotic strains can cause gastrointestinal symptoms like bloating, gas, or diarrhea, especially if used in excess or without proper guidance. It is important to select high-quality probiotic products with well-documented strains and to discuss their use with your healthcare professional, particularly if you have underlying health conditions or are on immunosuppressive medications. Multivitamins are perhaps the most common supplements among seniors, often taken daily to cover potential nutritional gaps. However, multivitamins can sometimes contain excessive amounts of certain nutrients, leading to toxicity or adverse interactions. For example, high doses of vitamin A, iron, or zinc can cause harm, especially when combined with other supplements or medications. Moreover, some multivitamins contain synthetic forms of vitamins and minerals that may not be as well absorbed or utilized by the body. For seniors with chronic health conditions or those taking multiple medications, it is better to identify specific deficiencies through blood tests and tailor supplementation accordingly, rather than relying on broad-spectrum multivitamins. Oversupplementation can also mask underlying health issues or delay diagnosis of deficiencies that require targeted treatment. It is also worth discussing the dangers of supplement interactions and the importance of medical supervision. Many seniors take multiple medications, and adding supplements without consulting healthcare providers can lead to serious drug-supplement interactions. For instance, combining supplements like ginseng, ginkgo biloba, or garlic with blood thinners increases bleeding risk. Calcium and magnesium supplements can interfere with the absorption of certain antibiotics or thyroid medications. Herbal products like St. John's wort can reduce the efficacy of drugs for heart disease, depression, or seizure disorders. Therefore, before starting any supplement, you should have an open discussion with your healthcare professional, including a detailed list of all medications and supplements you are currently taking. Furthermore, the supplement industry is not as tightly regulated as pharmaceuticals, which means that product quality, dosage, and ingredient accuracy can vary significantly between brands. Many supplements contain contaminants, fillers, or unlisted ingredients that can be harmful, especially to seniors with sensitive health conditions. Choosing reputable brands that adhere to good manufacturing practices (GMP) and have third-party testing certification can mitigate some of these risks. But it remains essential to be skeptical of aggressive marketing claims and to prioritize evidence-based approaches for health maintenance. You must also recognize that some supplements are marketed with exaggerated claims that promise miraculous results, often at high costs and with little scientific backing. For example, products claiming to boost memory or cognitive function overnight are usually unsupported by rigorous clinical trials. Relying on such supplements can divert you from proven lifestyle interventions like regular physical activity, balanced nutrition, adequate sleep, and social engagement, which have a far more substantial impact on aging healthily. Be wary of any supplement that claims to cure, prevent, or treat serious diseases without credible scientific evidence, and always seek guidance from qualified healthcare providers. Understanding the role of diet and lifestyle is fundamental in avoiding unnecessary or harmful supplement use. A nutrient-rich diet that includes plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats can often meet your nutritional needs without the risks associated with high-dose supplements. Regular physical activity helps maintain bone density, muscle mass, cardiovascular health, and mental acuity, reducing the need for pharmacological or supplemental interventions. Adequate hydration, social interaction, mental stimulation, and stress management are also key components of healthy aging that no pill can replace. In conclusion, while supplements can sometimes be beneficial when used judiciously and under medical supervision, many popular products among seniors do more harm than good when used indiscriminately. High doses of vitamin E and vitamin A, excessive calcium, unregulated herbal products, unnecessary iron supplements, and unproven memory enhancers are examples of interventions that carry significant risks. Always prioritize obtaining nutrients through a balanced diet, consult healthcare professionals before starting new supplements, and remain cautious of marketing claims that lack scientific validation. Your health in later years depends not only on what you take, but also on your overall lifestyle choices, regular medical checkups, and a proactive approach to managing existing health conditions.